folks in our hospitals who still are working very hard because our hospitals are still very busy, and they're continuing to do really hard work, including getting more people who've been waiting on their elective surgery. So thank them. But we're happy that these numbers continue to come down. Okay, we can go forward. So we've continued to see cases go on. We can take down the graph. We're also seeing hospitalizations decline in the last 2 weeks. This is important because we've continued to see this rate of decline, which has been important in our thinking on this. As you know, last Friday, the CDC released new guidance regarding masks, and that has had a significant impact across the nation, obviously. Our office and our Department of Health experts have now had a chance to look at the recommendations that they posited. And I think the CDC guidance reflects my view and our department's that we should be transitioning to a new phase in our efforts against COVID that particularly focuses more on our hospitalization rates. And obviously that's coming down sharply. And so this is why we've been able to loosen several of our requirements related to gatherings, vaccinations, and now masks. Now, the CDC presents 50 state data a little differently than we have been reporting our data. But today I'd just like to focus on the CDC's methodology and how it has moved our thinking. For 2 years, we have consistently relied on our state DOH data for the most accurate understanding of the pandemic in Washington state. But we've also considered CDC guidance as well in any new thinking on this subject. So let me just share what the CDC reports today for our state. The CDC sort of breaks up a combination of infection rates and hospitalization rates into 3 categories of activity: low, medium, and high. This shows our counties as the CDC would classify them today, with the yellow being low, the green being medium. Excuse me, I've got those backwards. Thank you very much. The low being green, the medium being yellow, and the orange being high. You note that we still have distinctions in our state. Pierce County remains high, even though King County is in low. But we need to look at this on a statewide basis. We think doing this just on a county-by-county basis has not been helpful in the state of Washington. So we want to move forward as a state at the appropriate time. And we think that is the best route forward for the state of Washington. So we have good news that we're going to continue to see, I believe, rapid declines in cases and hospital admissions. We can take the graph down. Based on their data, I'm confident that March 11th, we will be out of the high-risk category as a state. And that's how we thought about this. So we believe we'll be out of that category where the CDC would recommend masks by March 11th. Now, I do want to note that our hospital rates are down, but again, we think there's a reason for people to be careful, obviously, in part to help our people working so hard in hospitals. We are still bouncing back from the Omicron surge, so we're ready to lift this mask mandate on March 11. But we don't think it would be the right decision to do that earlier, given the need to move forward as a state. Now, additionally, in the coming days, we will be announcing what we think of as our next chapter on how we deal with this virus. We believe that this will be based, as I've indicated, on a provision of empowering individuals and families to protect themselves rather than having mandates. And we know that we are certainly going to continue our very vigilant and resourceful and dedicated efforts to protect our people from this virus. So our next phase in planning will involve commitments on multiple levels, and we'll talk about that either later this week or early next week. That's going to be a plan that will assure that we have adequate availability of vaccination if another variant comes back, that we have adequate PPE if another variant comes back, if we have adequate medical care if another variant comes back, as well as planning for a future in a whole host of endeavors. And I look forward, we'll have that plan, as I've indicated, later this week or early next week. It's important to note the date does not change any other aspect of the updated mask guidance that we earlier talked about. After March 11th, masks will still be required in certain settings, high-risk settings, healthcare facilities, corrections facilities, and long-term care facilities. So we'll look forward to continuing that work. So we know we're going to continue our efforts. They will look differently now as we move to this next chapter, but they will continue to be protective. So our commitment, our level of commitment is not going to change, but this virus has changed, and we're making decisions to act appropriately on those changes. It's also important to realize as we go forward, a lot of folks are going to want to continue to wear their masks, and we are going to continue to protect their right to do so. So our order will continue to assure that people can wear their masks on the job if they desire to do so. And importantly, students will be able to wear their mask should they and their parents desire them to do so. And I do note that because I do think it will be important for us to protect these children so they don't end up being teased about it if they do want to wear a mask. And I'm confident our educators will handle that with the compassion that they have to date. DOH actually will also issue some additional guidance for schools next week about safety protocols. And school districts can use these updates to
result of following the science and also after careful review of the CDC and its guidance that was released on Friday. I also would be remiss if I did not thank all Washingtonians for the incredible work that they have done to protect themselves and those around them. This has been a tough 2 years for everyone. We know that, but those who have gotten their vaccines, worn their masks, and followed public health guidance during this time, I really just want to say thank you to all of you for doing so. As we move forward, as Governor has mentioned, however, this is not a time to throw caution to the wind. Remember, the pandemic is not over. While we will no longer require masks in most places, we know a mask still offers protection. We also want to remember that as the state lifts our statewide requirements, local health jurisdictions, local health officers, and businesses have the right to enact their own policies related to masks as they see fit. So please, as we've been saying, these are safety measures, and please remember those safety measures. Be kind to those around you, especially those who may be living with someone who has a medical condition, maybe immunocompromised, or just feels safer because they want to keep a mask on. We want you also to respect, as we have been saying for months, the rules of the room. If you're in a setting where these safety measures in place, please follow them. Please be civil as you do so. we also want people to keep masks available because there may be a time where you do need it, and we certainly want to make sure that you have it available if necessary. Again, masks offer additional protection, but we do want to also remind everybody to get vaccinated and also to get boosted if eligible. And most importantly, or equally importantly, or absolutely importantly, stay healthy in all respects: physical health, nutritional health, and emotional health. So we know that things are getting better, but we also know the pandemic is not over. We are, as the governor said, watching for other variants, not just in our state, across the country, across the globe. We will do everything we can to continue to protect Washingtonians. We also want to just encourage you to do everything you can to continue to live your lives, but also to do so with health and safety in mind, and to do so together. So just wanted to add those additional comments, and I want to say thank you again to everyone. And Governor, I'll turn it back.
Thank you. Before we go to questions, I want to make some comments on behalf of the people of Washington regarding this unjustified invasion of the Ukraine by Russia. Simply put, the people of Washington stand with the people of the Ukraine. We stand with them against this outrageous foreign invasion. And we, in some sense, are all Ukrainians today. And we stand with those people in Russia who are protesting this vicious, malicious, totally unjustified act of violence. Because of that, I am directing today all of our state agencies to do an inventory to identify any commercial or other connections with Russian state institutions or significant Russian companies with an eye towards terminating them or canceling them and not letting them go forward. This cannot stand. And the entire world needs to be united in this regard. We intend to do our part in the state of Washington. But the defense of democracy is totally justifying that inconvenience. It is much better to have early, strong economic sanctions than it is to have delayed warfare. And we need to stop Vladimir Putin, starting today. We've all heard the Ukraine President Zelensky's resolute call for the world to unite. And I know I'm not the only one who was touched. Our home country as well. Our democracy was attacked on January 6th. Our democracy is still under attack by those who continue to allege lies about our election results. And the people of the Ukraine were denied at one point assistance because of the defeated president that led to his first impeachment. So I guess what I'm saying is I respect what the people of the Ukraine are doing on behalf of democracy because we're fighting for it too here in the state of Washington. So we're going to take the appropriate action to assist the world in this regard. With that, we have Deputy Secretary Lacey Fehrenbach also here. And with that, you may fire when ready, Gridley.
Up first, we'll go to Rachel with AP. Go ahead, Rachel.
Hi, Governor. As you know, California is lifting their statewide mask mandate tomorrow, and we're already seeing more and more people not wearing masks in stores here, probably because of what they've read about the CDC guidance. So given that, as you've noted, a variety of people will still likely wear masks after the mandate lifts, why not follow California's lead, if for nothing else, to create less conflict for stores who may not want to engage with customers about masks at this point?
Well, I'd ask it the other, why doesn't California follow us? We're actually doing very well here in Washington. So, no, the reason we've decided to join the masking mandate in schools and businesses is for consistency and simplicity so people could understand the date in the same place. And we actually have enjoyed great compliance. I think 294 of 295 school districts are in compliance right now. And we will give people the right to wear masks should they desire to do so. But until March 11th, we think it's the safe thing to do in these contexts for the state of Washington, so we've made that decision.
Next question comes from Joe with the Seattle Times. Go ahead, Joe.
Hi, in your earlier announcement when we were talking about lifting the mask mandate, your health metric was 5 hospitalizations per 100,000 people on a rolling 7-day average. What's that up-to-date average now, and what did DOH projections show it at March 11th?
Closing in on 5. I'm not sure they exactly show 5 on May 11th, but it's closing rapidly into that number. There is also another projection. Of course, these are all predictions. By the IHME group, which shows us actually getting to that number by that date. So these are all predictions. They have confidence intervals on each side of a week or two. We think this is in the very close to what we originally were thinking about. And looking at the CDC suggestion, we thought this was a reasonable approach based on both their suggestion and the epidemiology. And we feel this is a safe thing to do based on all of those things.
All right, up next, we'll go to Laurel with the Spokesman Review. Go ahead, Laurel.
Hi, thank you. This is probably a question for Secretary Shaw. Are there any concerns about the BA2 or any other variants potentially replacing the original Omicron strain and prolonging or creating a small additional wave of the virus in the coming months as places like Eastern Washington, where vaccination rates are low and masks are starting to come off in those areas, can just kind of explain the risks there? Thank you.
Yeah, thank you for that question. I think we always have to just remember that concerns are always there, and we continue to be vigilant about following the genotyping of what's being tested positive or what, which is not surprising because that's happening across the country as well. So yeah, we continue to monitor that. But I think the other piece that we've also been watching when it comes to BA2 is the potential benefit of cross-reactivity or cross-protection for those who have been either exposed, infected, or vaccinated, in particular with Omicron. And so I think there are a lot of really from many respects, there are a lot of things that we're watching, but I do want to say that there is some benefit here of the Omicron experience, which is sounds like a bad way to say it, but given that BA1 and BA2 is the sub variant of BA1, that is something that we do need to keep track of. Now, as far as your last point about vaccination, I think that is something that we have been saying for a year plus, which is regardless of who you are, where you live in the state of Washington, we have made vaccines both available and accessible, and we want to make sure that people continue to avail themselves of vaccines. That is not going to stop. That is something that we continue to do everything we can to work with our partners on the ground to make sure that vaccines are first and foremost the protections that people turn to when it comes to protecting themselves from not just the current Omicron or BA2 or any variant that is on the horizon horizon. So again, just want to say that our genotyping and genosequencing in the state of Washington is strong, and we want to continue to emphasize that we're monitoring, but still people should be vaccinated, and that's an important piece of protection for them as well as we move forward.
Next, we'll go to Austin with Northwest News Network. Go ahead, Austin.
Governor, I know that you've also focused in the past on the death rate in the state, and I just been looking at the dashboard. It looks like the death rate is still at 3.5 per 100,000 over a 7-day period, which is pretty high looking at the charts, and that the 7-day death count is 270. So I just wanted to ask about, because there are others who will say this mask mandate is coming off too soon in light of that, and also in light of the news today that the Pfizer vaccine is less effective, significantly so, for kids 11 and under. So taking the flip side argument that maybe we should wait longer, especially in light of ongoing deaths and the vaccine for kids, how would you respond to those who are concerned about this?
Well, the death numbers always follow by weeks and weeks the infection rates, and also by weeks and weeks the hospitalization rates. So we are confident that those death numbers will come down dramatically in the weeks following the decline in infection rates and then hospitalization rates. And we think, and particularly if you're vaccinated, 95% of the people who are becoming hospitalized are unvaccinated. So look, you've got the ability to stay out of a hospital right now to get vaccinated. That's one of our thinking about this, is people have the ability to protect themselves because this vaccine are extremely still successful. I haven't seen the comment about Pfizer you made, but I can tell you that 95% of the people in hospitals are unvaccinated. So we know that these vaccines are extremely effective. By the way, that's a death number, not a hospitalization number. I think hospitalizations are closer to 80 or 88%, I believe. So we know the vaccines are tremendously effective. We know that the death rates are going to come down, but they won't come down for some period of time after the hospitalization rates come down, because as people typically go in and stay for weeks and weeks, unfortunately, till they pass. So that's the reason. We know they are going to come down. We might make a different decision if we didn't have high confidence in that regard.
Up next, we'll go to Jerry.
By the way, I also, again, our death rate in the state of Washington is one of the lowest in the United States. And the decisions we have made have been different than other states. And it has kept the death rate very low relative to other states. So whatever it is today, it was 2 times higher in many, many states, unfortunately, because they did not take the measures that we took. So I would not make this decision if I didn't believe it was safe for the state of Washington, reasonably safe, given all the things concerned, the low infection rate, the declining hospitalization rate, the universal, almost universal access to vaccine, the increasing ability to have treatments after infection, the continuing ability to wear masks if people want to use them, which we are going to protect. All of those things, I believe that this is a reasonably safe thing to do, and I wouldn't do it otherwise. And I think people look at my record. I have not been shy about standing up for public health. It's saved tens of thousands of lives, but we've had a lot of controversy about this in our state, but I don't regret 1 second the lives we've saved.
Next question comes from Jerry with the Everett Herald. Go ahead, Jerry.
Thank you. Actually, 2 quick questions. One on COVID. Governor, does the next chapter you were talking about include ending the emergency declaration? And on the situation with Ukraine, if a company in Washington does disassociate itself, but in so doing loses revenue, are you prepared for the state to provide them support to make up for that loss?
No, I don't have any plans for that right now. I think all of us and all of our entities of whatever organizations we belong to, from fraternal to athletic to artistic to corporate to state to local governments, have the potential to assist this international effort. And we have industries in our state that could have a role to play in this drama. And I would say it's going to be a lot worse for business if we end up in some type of armed conflict with Vladimir Putin because he doesn't get the message that we are not going to let him go into Poland and Bulgaria and Hungary and Latvia and Estonia. He needs to get that message. And I believe every entity in the world ought to give him that message. So if it costs 1/10 of a percentage point for a business, that's a good investment right now in the long term. And so I'm going to support any business who wants to join the state of Washington in saying no to Russia. And we are saying no to Russia. We are not going to do business with you in the state of Washington, period, as long as you're in the Ukraine. So I welcome their decision-making, should they desire to think about it. Your first question was, Jerry?
In the next chapter, does your next chapter include lifting the emergency declaration?
Not in the near future, and I'll tell you why. There are some things that we still need to do in regard to this pandemic. Number one, we got to keep our hospitals safe. And that means we do need, for the foreseeable future, keeping the mask mandate in our hospitals to make sure they can continue to function. Nurses don't get sick, patients don't get sick. That's very important. We need the emergency order to allow us to continue that safety protocol for hospitals. Second, we need the emergency order to protect the ability of employees to wear a mask should they desire to do so. Last year, the legislature passed a law that allows employees to wear a mask if they desire to do so, but only as long as the emergency order is in effect. So that needs to continue. Third, we think it is also of assistance, at least right now, in the ability to get some federal funds of having that in place. So there's several things that we need to keep that as a tool in this response. But I would note that we have now removed, if you ask the common citizen, we've removed 95% of the things that people have found controversial. And that's because Washingtonians have been very responsible doing things to protect themselves and their family members. And that's why we're in this position today.
Next question comes from Shauna with McClatchy. Go ahead, Shauna.
Good afternoon. My question, now with, lots more vaccination rates and the mask mandates being lifted soon, are there any plans to do more to get the restaurant and tourism industry moving again?
Well, we've had a host of assistance programs for that industry. I don't know how many millions of dollars we've provided to the industry, but it's been very significant. I'll try to get you that number. I don't know right now whether those funds are still available in that fund or not. I'll have to get that information to give it to you. I'm not proposing, at least legislatively, a specific thing for restaurants right now. I'm glad we have been able to provide millions of dollars for help for them during these difficult times. And I'm glad we're in a position today to announce we are removing mask mandates in their businesses, last day, March 11th. So I'm glad to be able to say that. I know that will help them. And I want to thank the restaurateurs who've been both creative and diligent in very, very difficult times. They have gone through holy heck, trying to keep their doors open during the darkest days of this pandemic. And the vast majority of them have done everything they can to comply with what we've asked of them. And because they have, we have been able to save thousands of lives. And I want to connect their efforts to saving lives. Usually we think nurses and doctors save lives. No. Restaurant owners who followed these hygiene requirements, they saved lives, tens of thousands of lives, by keeping our death rate low in the state of Washington. Our hats are off to them.
Next question comes from Keith with KOMO. Go ahead, Keith.
I heard you answer to Jerry's question, but Republicans are asking, they don't believe the numbers that you're using are really up to date. They believe that the The metrics are already in place, that there's enough room now to reopen and have everything happen today, and they don't believe you need to continue the emergency powers. Why not end that emergency today? Let them join you in all these decisions, and if you need another emergency, just call it.
Well, I don't know what you're referring to, Keith, so if they want to sit down with me and look at the numbers, I'm hopeful. I'm very willing to talk with them. They're open, they're available. The numbers are the numbers. There's no question about this. They just they've always wanted to follow Donald Trump. That's the central problem here, who first said this was going to be over by Easter. Then he told us you can take horse deworming products, and has always diminished our ability, and who refused to help the state of Washington when I asked him to help. And the Republicans in this state have followed him and continue to follow him, and continue to refuse to stand up to his coup attempt. So, with all due respect, I will be happy to talk to them about the numbers. But we need this emergency order for the 3 reasons that I just articulated. We need it to protect hospitals so that people don't get sick from this still deadly disease by requiring masks in hospitals. We need it to protect employees, and apparently the Republicans don't care about employees who want to wear their masks. I do, because a lot of people in this state are still going to want to protect themselves by wearing a mask. Now, we have a difference of opinion with Republicans. We respect working people, sometimes they don't. So I'm standing up for working people's ability to wear a mask. I am sorry they don't share that view. And third, we need it to be able to keep federal funds so we can get federal assistance rather than state tax dollars. So there's 3 reasons, but send them my way and I'll show them the numbers.
Up next, we'll go to Steve with King 5. Go ahead, Steve. Steve, are you there? All right, we will try Hannah Scott with Cairo Radio. Go ahead, Hannah.
Hi, good afternoon. This is going to be for, I think, probably Dr. Shaw. We're seeing reports from several medical experts warning against the rush to lift the mask mandate and shift the focus specifically or solely to hospitalizations as far as any metrics. They say it doesn't account for the unknowns of COVID, and that solely focusing on hospitalizations allows for high burden of disease that would basically lead to a delayed response. I wonder if you can speak to those concerns.
Yeah, Hannah, thanks for the question. I would say that, we've said throughout this pandemic that it's a summation of information that we follow. And so while we may be focusing on one measure, a couple of indicators, or 3 or 4 or 5 trends, whatever the case may be, we watch the entire picture. And the way I look at it is that, if you take a photo, it's a snapshot, but when you take a video, it is an entirety of what's occurring in context. And that's what we're doing. So while we may be continuing to focus on a couple of measures, and we do believe that hospitalizations is an incredibly important measure. And so I do disagree if anyone is suggesting that hospitalizations are not important. However, we're looking at the entire picture. And I think that is really the critical piece of this. I would also say that we also are absolutely continuing, as I said earlier, watching variants across both the globe, the country, and in our state. And so we are keeping track of what's happening. And because of the strong genotyping, genosequencing system that we have here in the state of Washington, that allows us to get an earlier look at what's coming down the pipe. And so that is another consideration as part of all this. So I would just say that, to those who may think that we are not keeping track of anything specific, or that we are looking at only one measure, the answer is no, we're not. We're looking at all of them. And yet we're continuing to focus on what makes sense. And I think the governor has made it very clear. And so, we at Department of Health have made it very clear that we need to know the entire comprehensive picture of what's happening in the state of Washington. And so, frankly, when you're hearing a lot of comments that are occurring from across the country, they're also looking at their own state context or their own local context. And we're looking at what's happening within the state of Washington. And even today, with our alignment with Oregon and California, there's still nuances to what we have in the state of Washington, and that's what we continue to be focused on.
If I may add another reason to focus on hospitalizations, it comes to what we're really trying to do here at this point. So at this point in the virus, we now have the ability individually to protect ourselves. We didn't have that before. We have the ability to wear masks. We're going to continue to protect that should you desire to wear it. And importantly, you have the ability to get a vaccine. Almost everybody in the state now has access to a free, safe, extremely effective vaccine. And if you choose that vaccine, your chances of getting hospitalized or dying are something like 15 or 16 times less than if you don't get the vaccine. So the point is, we now have the ability individually, by making individual decisions, to protect ourselves. But what we want to do is to make sure that for the people who are not getting a vaccine, who unfortunately are going to the hospital and unfortunately losing their lives because of that decision, that those people do not jam the hospital system so that people with heart attacks and car wrecks can't get treatment and elective surgery. That's kind of the goal of this at this point. Now, I have to tell you, it's very sad to me and extremely painful to know more people are going to lose their lives to COVID for months and perhaps more because they refused to get the vaccine when it was freely available to them. That's extremely painful to me. We have done everything humanly possible to reduce that. The goal now is to prevent our hospitals from becoming jammed, and I am very confident we will succeed in that goal by removing this mandate on March 11th, because the course of this virus has been consistent all over the world. We can see where we are on that curve, and we are going to continue to go downward, and I am very confident we're going to achieve our goal of keeping our hospitals open. I would continue to ask people to talk to their loved ones about getting this vaccine, because we are still losing dozens of people every day, and it is totally unnecessary. But we're doing all we can.
We will try Steve with King 5 one more time. Go ahead, Steve.
If you can hear me, Governor?
Yes.
All right, great. If the next Monday, for instance, the data is going even better than you expect, might you end the mandate even earlier, or is it kind of May 12th no matter what?
I think we need to pick a date so that people will so they can plan, so they can have confidence where we're going as a state. I really don't think there'd be a reason to change the date at this point. We know where we are, we know where we're going. We want to keep it easy to understand. It's the same day for businesses and schools and kids and parents. We're just going to stick with this.
All right, we have a couple more questions. Up next, we'll go to Joey with Puget Sound Business Journal. Go ahead, Joey.
Hi, Governor. Thanks. Two questions. First one for you. There's a bill in the Senate right now to impose nurse staffing ratios, stricter penalties for hospitals breaking them. Nurses say it's the only way to deal with the dilemma. Hospitals say it's too expensive. If you have any thoughts on that and where it might go and how it might get to your desk. And then for Dr. Shaw, as you were talking earlier, businesses are going to have the conversation of whether they enforce their own mask mandates. What advice would you have for folks? Specifically in the Seattle area, I would expect a lot of operators are feeling pretty, not quite sure how to go forward. So any advice for them? Thanks.
The nursing issue, I'm inclined to be supportive of efforts to make sure that we keep our folks in medical care healthy, and that's what this is about. I haven't seen the specifics of the bill, so I can't give you a black or white answer. But I do believe our working people are working so hard, they deserve protection. But we also have to find a way to staff these hospitals, and that means going forward, we're going to have increased training for people. We have to be attentive to compensation to bring them into the industry. We have to continue our efforts to build long-term care capacity so we can discharge patients out of hospitals when they're ready to go. All of those things will be extremely important to reduce the burden on our nursing staff.
Thanks, Governor. Thanks, Joey. What I would say first is, again, the reminder that the statewide requirement would be going away after March 11th. But those businesses and local communities, I would really honestly make sure that they are continuing to work with their local health departments, local health jurisdictions, their local health officers. And again, the comment is always a nuanced answer, and so let me make sure that I add this in, that there are going to be some businesses that will have a propensity for, they may not have the ventilation, or they may have very crowded settings, or they may be in a situation where they have a higher unvaccination rate in their community. Those are the kinds of businesses that may want to consider having additional safety measures in place. Those that are in places where that's not the case, that they have, outdoor seating, or even it's a spread out restaurant, or you've got a lot of folks that are, wearing masks or choosing to wear masks and also vaccinated. Those businesses may decide to go a different way. But regardless of which decision is made, I hope that what they will do is to consult with or contact their local health jurisdiction, local health officer, and they can have that discussion. And again, what we're saying today and what we said previously when the March 21st announcement was out there is this is the end of the statewide requirement, and it does not mean that there cannot be additional requirements at a local level. Governor, anything you want to add on that one?
No, we got it.
The last question comes from Kelly with KATU. Go ahead, Kelly.
Sorry. Hi, Governor. Can you hear me?
Yes.
Lots of struggles today with the internet. Sorry about that. So one of the big questions, obviously to be a little bit reflective, we have been kind of in this position before where we saw numbers going down, where we had a little more relaxed rules, if you will, on the masks. And then we were right back with the Delta variant and having to mask up again. So going forward, can you kind of explain the process of what you guys are going to be doing, looking at those other variants, and also judging and making your decisions on mask mandating ever again? I think there's a lot of people out there who are a little bit nervous that coming another month from now, we're going to be back to wearing masks and back to restrictions.
Yeah, well, in the effort of reflection, what I would say is, I actually think our decisions when we have relaxed some of our restrictions actually have been appropriate. But what happened is a new variant showed up. And when a new variant shows up, you have to respond to it. It would be foolish not to respond to a new variant. And when new variants have shown up, we have responded to them. Look, if you're attacked by a new enemy, you got to respond. And that's what has happened. So I don't think the new variant showed up because we relaxed our restrictions. These came from outside our borders. They were variants that started somewhere else. They were going to end up here no matter what. So what I think the kernel of what you're asking is, should we be ready for another variant? You bet we should. And that's what I was talking about later this week and maybe early next week. We're going to roll out a plan to show how we will be ready for the next variant. That starts with good sequencing and good surveillance. Now, fortunately, we have probably the best surveillance in the United States today already. But we're going to look to make sure if there's anything we can do to increase it, to see if there's any earlier jump on recognition of this. Frankly, it's been really good already. We were the first one to discover this in the United States, and we've been on top of it ever since. We have not lacked for understanding the infection rate in this state. But we're going to look to make sure if there's anything we can do to make it better, we will. Then we're going to look, obviously, if there's anything we do to improve our vaccination rate, we want to make sure that we have the ability to rapidly ramp up our capability to implement the vaccinations. Is there anything we can do to make sure we got the reserves available on quick order? Now, I think we can do that because we've demonstrated our ability to do 45,000 injections a day. It's just been people haven't volunteered to come. Then there's PPE. We want to have a plan so that we will always have the ability to have appropriate PPE. when and if we need to universally put on our mask again. And we're going to be talking about that. Then there's a whole hospitalization capacity issue. This is a hard one because it takes time to build up capacity, but we will be looking at ways to make sure we can do the ultimate in that regard. And obviously the educational component of this, we'll be evaluating, have we done everything we can to help people understand the value of vaccinations going forward. And I do want to reiterate, that vaccine is, is just as important on March 12th as it is on March 11th. And because this is going to be continuing to be with us for a considerable period of time, at least. And these vaccines work. So we're going to continue talking to our citizens about that. So when would we implement new restrictions? Like it has been, when it's the right time. When the disease burden and the rate and the capacity of choking off our hospital system is so dire that we have to have these restrictions, then we could again. But I hope that day does not happen.
Any final words, Governor?
No, I want to thank everyone. It's been a long 2 years. It's a marathon, and we just moved the tape. It was about 25 yards away. Now it's, 11 days away or so, or 11 yards away. But let's run through the tape. Let's get this job to the next chapter and be ready and protect ourselves and do everything we can to do that. Thank you.